I don't know the typical format for these, but I wanted to share a little bit about myself as well as kind of an high level overview of kind of the research that I do. So, my research really focuses on supporting families who have children with life-limiting or chronic illnesses. Um, a little bit about me. I am a nurse by training and spent most of my career working in the pediatric and critical cardiac unit in Salt Lake City at Primary Children's before going back to school and getting my PhD. I love working in teams on interdisciplinary projects and outside of work. I love everything and anything outside. I have two teenage boys and a Great Dane, so that's kind of me. In terms of my PhD training, I went to the University of Utah where I participated in their T32 training program, which was focused on cancer caregiving and end-of-life research, and transitioned that into an F31 that supported my dissertation, which was focused on adolescent siblings of children with cancer and how they leverage social support for social media for social support during that time. And I've had some really great opportunities to work with the Family Caregiving Collaborative, which is a national group, and the Sibling Partnership for Advocacy, Research, and Care, which is focused on really making sure that siblings are included in the research work that we do around families and children with health challenges, because they're often kind of an invisible partner and piece of the puzzle that doesn't often get looked at, but is really important. And then came here in 2022 for a postdoctoral research fellowship in the Center for Healthcare Delivery Science. So as I said, my focus of my research is on these families who have chronic and life-limiting illness. And this really came from, my background working in the ICU and watching many of these families struggle. They can spend months at the beds having a child in the ICU. And then there's this huge aftermath of care and caregiving that comes from that. And we can take really excellent clinical care of our patients, but sometimes we don't take into account their whole family kind of construct, all the different pieces of their home, family life, finances, and all of these things that affect their mental well-being over the course of navigating these illnesses. So I have two funded studies right now. The first is focused on families who have a child with congenital heart disease. And this started in my fellowship training where we did the first study looked at kind of what are the socio-ecological challenges, different levels of challenges that come to these families as they're trying to prepare for surgery and then, being in the hospital for a period of time and transitioning back home. And that study told us a lot about modifiable issues that really would be pretty easy to address, but that families aren't getting consistently. Things like, help with their insurance, social needs, support, finding social support, finding, daycare for their child. How do they even talk to their child about the surgery that they're having without scaring them, but helping them be involved and preparing them, and also siblings needs. So we interviewed both, we interviewed a caregiver, the siblings and patients to sort of get that whole family perspective and understand their needs across this experience. And so my current project is taking all of that information through, and this is funded through AHRQ through PedsNet, and we're putting together a toolkit for families to help them get this information and resources in a more structured way, and also working with them to understand how it should be delivered. And so hopefully I'm in the process of writing a K-23 now that will really look at building this into an intervention that we can deliver to parents. The second study that I am working on right now is funded by the Rita and Alex Hillman Foundation. And so just as a kind of an overview, it's estimated that 7 to 14% of youth are bereaved before the age of 18. And, these experiences for these young children can cause a lot of emotional distress, as you can imagine. And there are important, pieces of that. They have a hard time focusing in school. They have cognitive challenges. They can have social challenges that cause them to fall behind or drop out of school, engage, in drug and alcohol use, and these can have long-term effects into adulthood. We also know that children of color are twice as likely to experience the death of a sibling due to social challenges that disproportionately affect them, whether it be pollution, violence, or poverty. And so, this is a really, important, I think, um, problem that I think people are less aware of. So a pre-pandemic study demonstrated that 70% of teachers have interacted with a bereaved child, but they really get no formal education or training. And there aren't good accommodations or supports for these children during this challenging time. So parents, teachers wanted support and families need support. And so this project, we used crowdsourcing methods to understand the needs of youth as they transition back to school after the loss of a brother or sister, as well as the parents, learning a lot about their challenges, navigating their own grief and supporting siblings. And so we put together through this study a list of accommodations that families need, as well as communication tools for school administrators to be able to reach out to families and know what they need and, how to talk to them about providing accommodations, and then how to help parents and siblings or these young kids be able to talk to each other to form a plan going back to school. And so we're in the process right now of formalizing those resources and turning that also into hopefully some education and interventions that can be implemented in the school setting.